We have some major news right now. Doctors are increasingly concerned about Donald Trump's health and the lack of transparency that we're getting from the White House. Now, today I spoke with leader Hakeem Jeffries, who called for an immediate congressional investigation into the White House's apparent cover up over Donald Trump's health. And now doctors are even coming out and saying, well, what the White House is giving us is simply not enough. We learned today, according to a Wall Street Journal report, that the chairman of the RNC, Joe Gruters, was, quote, shocked when he saw what Donald Trump ate on a regular basis. The McDonald's meal that Donald Trump eats is 1,960 calories. Folks, for perspective, the daily allotment that you should be eating, 2,000 calories. That's just one meal for the president. And when you look at the details of this meal, it gets even worse. French fries, quarter pounder, Big Mac, and a fillet of fish, all in one sitting, keeping the RNC chairman shocked and keeping doctors concerned over the president's health and future. Make sure to like, comment, share, and subscribe because while the media may not talk about this regularly, I will. If you want to support my work, subscribe to my Substack at the link below. Let's just jump right into one doctor who appeared this evening on CNN, Dr. Jonathan Reiner, who spoke exactly about essentially how Donald Trump's health has actively gotten worse over the past many months.
Well, I'm mostly concerned that the public really hasn't been told essentially anything meaningful about the president's health here. So let's turn the clock back and look at what's gone on over the last 9 months. The president had a physical exam, a comprehensive physical exam in April at Walter Reed. And they listed a bunch of studies which were essentially all normal. The president was great, and there was nothing else to see. Over the summer, the president developed really greatly swollen ankles, which prompted another series of tests. They called that chronic venous insufficiency, despite the fact that just a few months earlier, during his comprehensive exam, the president's physician said he had no swelling of the leg. So it doesn't sound so to me, it sounds more acute. And then something happened in the fall. Something happened in October that prompted an off-cycle series of tests by the president's medical team. And when the results of those were released to the public, they used some basically euphemisms to describe what the president, the test the president went through. And the euphemism was advanced imaging. And they didn't describe whether it was a CT or an MR. And then later on, a few days later on Air Force One, the president basically said he had an MRI, couldn't describe what body part, but he said he had an MRI, which prompted the president's physician again to release another statement, at which time he again did not describe the specific test the president underwent and said that, again, everything looked fine. And now we learned that the president didn't have an MRI, he actually had a CT scan, which explains why the president's physician didn't describe the test after the president disclosed his MRI because he didn't have an MRI. So as best we can tell, the president had a cardiac CT, or what looks like a CT angiogram, which is basically a non-invasive way to tell whether the president has any significant coronary artery disease. And in his statement to the Wall Street Journal, the president's physician, Dr. Sean Barbabella, basically said the test looked great. There was no abnormality, which actually doesn't correlate with what Dr. Ronnie Jackson told the public in 2018 when he disclosed that the president had a similar CT scan that showed the presence of coronary calcium, which is a marker of coronary artery disease. So I'm almost less concerned about the actual cause of the president's bruising. We can talk about that than I am about why the White House medical team has felt the need to study him in the last few months. What symptoms, what clinical concerns have prompted this? Because
I think that's a good question. And I think that's something that a lot more people need to be asking about. Specifically the fact that, listen, like at the end of the day, like it is very weird that this president is getting multiple studies done. He's getting multiple physicals in a year. Ask yourselves why. Doesn't make any sense why he's doing that, especially if he's fully healthy and everything's okay. And ask yourselves why his White House and those around him seemingly aren't providing any information, any transparency about it. Just Caroline Levitt saying that the reason why his hands are bruised is because he shakes hands so often. Like, that doesn't make sense. Give me a break. And now we're learning he takes 4 times the recommended dose of aspirin. Take a listen to what Dr. Reiner had to say about that.
What the president said about aspirin, which has gotten a lot of attention, taking more aspirin than what his doctors are recommending, and his rationale for doing so, which is, he said, quote, "They say aspirin is good for thinning out the blood, and I don't want thick blood pouring through my heart. I want nice, thin blood pouring through my heart." Does that make sense? Does that make sense?
Yeah, so that makes no sense. That actually makes nonsense. So first of all, when we use any kind of anticoagulant, medications to prevent clotting, those don't thin the blood. It's not like changing something from gumbo to chicken soup. It doesn't make it thinner. It makes you less likely to clot. And it used to be that we would treat a lot of people with aspirin therapy to prevent heart attacks. But we've learned in recent years that particularly people over the age of 70, not only is there no benefit in terms of just primary prevention, trying to prevent a cardiac event by giving them aspirin, that there can be hazard. And the hazard can be bleeding, significant bleeding. So here's the interesting thing about this. The president apparently is taking 325 milligrams of aspirin per day, which is essentially one adult-sized aspirin tablet. But the dosage that we use for patients, even with documented coronary artery disease, is a quarter of that, is 81 milligrams per day. So why is the president taking, an unorthodox dose of aspirin? And the media has published, many photos of his right hand and now maybe his left hand with this chronic bruise. The White House has said that this is related to, chronic aspirin therapy. So if you're bruising a lot and your doctor says you're on too much aspirin, why wouldn't you go down to the lower dose? It makes no sense to me.
Dr. Jonathan Reiner.
Good questions, right? All good questions. If you're bruising and doctor says go down to the lower dose, why not go to the lower dose? Good question, right? What we're leaving in 2025 is a lack of transparency. We are leaving that in 2025. Heading into 2026, we are demanding more accountability and more transparency from our leaders. We're demanding more accountability and transparency from this White House. And truth be told, right now, we're not getting it, especially as it relates to the president's health. It's why Hakeem Jeffries called on a complete investigation from Congress today. It's why journalists are going to continue digging into it. Make sure to like, comment, share, and subscribe. Spread the word. Subscribe to my Substack link below to support.